afternoon all the participants and students. Behalf of the department and Dr. B.R. Ambedkar University, we are welcomes you all today's very good discussion on the topic mood disorder and suicide. This topic is especially for the benefit of students of UG Psychology second year, that is abnormal psychology existed in fourth semester, and the PG students of psychology first year, the course related to psychopathology, and also the course related to diploma in psychological counseling. It is nothing but the course psychological disorders. So both the courses have this topic, and this is very important topic because we know everything, the kind of nature of the individual. So most of the times they expressed, I moved out, I moved upset, and I am not well as in terms of mood like this. So why it will be happen? What will be going on in our mind and in our body, or biological or psychological relating issues? So in this purpose we are invited two experts for the discussion of this important topic. One expert deals with Dr. Viswanath Garu. Namaste sir.
Namaste.
The sir has a vast experience in the field of clinical psychology as well as academician, and sir has very important aspects like LD and OBE and like that therapies and clinical practitioner, as well as more concerned with the organizational skills and motivational skills. So one more expert, second expert relating to Dr. Vidya Sagar. He was one of the very renowned clinical psychologist. From the last 12 years, he was involved in the mental health experience, the MPhil clinical and doctorate in clinical from NIMHANS Bangalore, and he was also involved various course teams in our Dr. B.R. Ambedkar Open University, also involved some of the stress management course, some of the videos like stress management units. So I welcome Sagar, Dr. Vidya Sagar. So in this regard, sir, Dr. Viswanath Garu, especially today's topic is very important to us because we know everything. The society will depend on individual mentality, but so many times people talk about the mood upset, or some of the people think about the suicidal thoughts like that. So why is it important to understand and mood disorder, sir?
Yeah. Good afternoon, all of you. It's really a pleasure to be here this afternoon. For the next few minutes, I'll be talking about mood and mood disorders and certain issues related to mood disorders. To begin with, let me give you the backdrop of these mood disorders. Mood is a commonly used word by all of us. In day-to-day parlance, many of us, we keep using the word mood, we keep using the word feeling, we keep using the word emotion. All these words we keep using. Now, why is it important for us to understand this particular topic about mood disorders? If you carefully examine, World Health Organization has come up with an interesting report. I am not intentionally getting into certain statistics. The report says that the prevalence of mood disorders has become more in the recent past. In the mood disorders, compared to manic disorder, the depressive disorder prevalence has become more. That's the reason why it is important for us to focus, understand and comprehend. Before moving further, I would like to tell all of you that this session is meant to enable conceptual knowledge related to mood disorder. This session is not meant for enabling diagnostic understanding related to mood disorders to all of you. Hence, I would be talking more on conceptual aspects. So having said that there is a high prevalence, it is important for us to understand what it means by mood disorders, what are various mood disorders, can we really do something about these mood disorders, and who are more prone for this kind of mood disorders. In addition to that, it has been examined by clinical psychologists and mental health professionals that mood disorders have high impact on individuals. Individuals' quality of life and individuals' functioning is impacted over a period of time when they suffer this kind of mood disorders. Further, there has been a very strong link that has been established between mood disorders and high suicidal risk. In other words, people who have mood disorders, people who suffer from for a very long time with these mood disorders, they have a high risk of getting into this kind of suicidal risk. Nevertheless, we are all human beings and mood is not a new normal, and in the history of mankind, in many books, the issue of mood has been discussed. Okay, even if you look at literature like Crime and Punishment and several other books and dramas and novels, okay, human moods and human irritations and human prejudices and human predilections have been discussed, and it is important for us to develop a very interesting understanding about mood disorders. Let me also give you another important dimension to these mood disorders. There is a concept called diagnostic hierarchy. When a patient or when somebody comes and starts sharing his or her predicament with us, what we do is, there are 5 aspects we look. People like me and Dr. Vidya Sagar, we look at 5 aspects of disorders. Number 1, whether this person has any kind of mood disorder or not. This is hierarchy 1. Second one is whether this person has a psychotic disorder or not. Third one is anxiety disorder. Fourth one is personality disorder. Fifth one is any other kind of disorders. So when mood disorders occupy hierarchy 1, it is important for us to understand what does it mean by mood, what does it mean by a person having right mood, healthy mood, and a mood disorder. Further, as I told you, the purpose of this session is not to give you diagnostic understanding, but to give you conceptual clarity, and my request to all people who are listening to this lecture, not to really label people saying that okay, he has mood disorder, she has mood disorder and all that. Don't get into that. So with this background, we can start discussing with this topic.
Yeah, Dr. Vidya Sagar, we know generally suicidal behavior is common among people with mood disorder. So what causes about these mood disorders?
See, like any other psychiatric illness, you don't find one particular cause for one psychiatric illness. There are variety of factors that interact to produce or to cause a mental illness, like for example biological factors, psychological factors, okay, and environmental factors. So all of them they interact to produce any psychiatric illness. So there is an interaction of these probably in some disorders biological factors play a major role, but in some psychiatric disorders psychological factors play a role. Okay, for example, if you take in mood disorders, in bipolar disorders, it is known that biological factors play a role more than psychological factors, whereas in depressive disorders, it is probably more of psychological factors that play a role. So variety of factors play a role in these disorders. For example, if I take depression, if I talk about depression, like for example, there are certain psychological theories like cognitive theories. So they say there is a cognitive triad of thinking. Like for example, you have negative thoughts about yourself, that I am good for nothing, I am worthless, or there are negative thoughts about future, my future is hopeless. Okay, or there are negative thoughts about the world in general, world is not a safe place, like for example. So these kind of negative thoughts or this particular kind of thinking can lead you to develop a particular kind of a mood, usually a sad mood. Okay, and for example, there is also these individuals also have a thinking that they are a burden to the people. Okay, so there is a burdensomeness. Okay, so that kind of a thinking. Again, there is a particular style of thinking called pessimistic style of thinking. When things go wrong, they attribute reasons of these things going wrong to themselves, that is internal causes, that is I am like this, and they also attribute to global causes, that it's always going to be like this, okay, and they also attribute these things to stable factors, that it is never going to change. So I am like this, it's always going to be like this, and it is never going to change. So when you have that kind of a thinking, you are bound to experience certain kind of hopelessness or helplessness, so which is also probably associated with development of negative mood. And these individuals also have certain kind of thinking called negative repetitive thinking, where they ruminate about things that have happened in the past. Okay, I should have done this, I should have done this. So always thinking about the things that have gone wrong, and remembering those things makes them to experience sad mood. Okay, so they also have a particular form of thinking called self-critical thinking. When things go wrong, they tend to criticize themselves. They find it very difficult to be compassionate towards themselves. Like whenever they do a mistake, they find it very difficult to say it's okay, that's fine, we are all humans, we can make mistakes, but they tend to be harsh towards themselves. So, and I mean, these are some psychological factors, but if you also talk about neurochemical factors, there are neurochemical factors like deficiencies in a neurochemical called serotonin, norepinephrine. So they are known to, these abnormalities are known to be associated with depressive disorders. That's why we use a medication which improves these levels of these particular neurochemicals. And even structural abnormalities in our brain, like for example, they found that people with depressive disorders, they have lower levels of activation in their frontal lobes, frontal cortex, and higher activation in something called amygdala, a part of the brain which is responsible for their emotions. So host of factors, like we have discussed psychological factors, we have discussed neurochemical factors, we have discussed structural and functional abnormalities of the brain, and there are also genetic factors, like if probably one of the family members or in your family history, if somebody had any mood disorder, probably you have the risk of developing the mood disorder. It doesn't mean that everybody like whose family members have illnesses, every one of their family members would develop, but it means that they have a risk. So if the healthy conditions are not present, like if they are present with, let's say, extreme stressful situations, whatever this vulnerability that is present in them, the risk that is present in them, would express it as a mood disorder. So as I mentioned, a variety of these factors interact and lead to the development of any disorder, including mood disorder.
Okay, thank you, Sagar. Students and participants, this discussion will be going on up to 2 to 3 o'clock. Up to 2:45, you need to concentrate on the topic. If any queries or if any want to interact with these experts, you need to call 040 23 680 456. Once again, 040 23 680 456. So after completion of this discussion, you need to interact with the experts and clarify your doubts or issues. Yeah, sir, Dr. Viswanath garu, according to Sagar, there are so many factors are involved in these mood disorders. So generally, what is the significance of the mood disorders and how we can assess that kind of disorders?
Yeah. See, when we are talking about this specific word mood, we have to understand what it means by mood. In fact, there are quite a few nomenclature that is associated with this. Mood, affect, feeling, mood, affect, feeling and emotion. I'll give you an example. If I have set of students before me, and if one student is very mischievous, and if he is not listening to me, if he is not processing the information that I am teaching him, I might become so angry, I might lose my cool and I may take the pen and I may try to throw my pen on him. So that is not a mood, that is emotion. Emotions are associated with physiological changes, whereas mood is longer lasting and it stays from hours to days in an individual. It is generic, it can be long lasting in an individual, it colors the total experience of an individual. So there is a subtle distinction between mood. Mood is also a kind of subjective experience of an individual. Similarly, feeling is also a subjective experience, but feelings last for minutes to maximum hours, whereas emotion doesn't last for an hour. Emotion lasts for a very brief point of time, and it lasts only from seconds to minutes, only that particular point of time. Emotions are very intense and it is relatively short term, whereas the word affect is a very generic word and it can be used in a very momentary way. So the word affect encapsulates moods, feelings and emotions. Now if you look at the literature, the psychology literature, the psychiatry literature, you can come across words like, you can come across phrases like mood disorders, emotional disorders and affective disorders. Now with this background, let me introduce two concepts to you. In the field of clinical psychology and clinical psychiatry, there are two classificatory systems. Number one, Diagnostic Statistical Manual of Disorders. Second one is ICD, International Classification of Diseases. Okay, for their own reasons, let's not get into that. There is a huge amount of discussions that take place in their consortia. They have used words in their own way. Some people call it mood disorders, some people call it emotional disorders, some people call it affective disorders. Now, having said this, let me give you an understanding of what it exactly means by mood disorder. See, when somebody is moody, when somebody has a lot of emotional turmoil within oneself, what can happen is there is a possibility for the individual to be depressed, and there is also a possibility for the individual to get into emotional roller coaster. Now there are two aspects predominantly in mood disorders. One is depression, the other one is mania. Now let me tell you what happens when it comes to depression. See, people who are depressed, okay, I don't want any of you to get into self-diagnosis of labeling yourself as depressed and all that. Okay, I'm not getting into that kind of diagnostic criteria. Now, people who get depressed, they have loss of, they don't have interest in the activities once they enjoy. If I'm the kind of person who enjoys eating sweets, okay, if somebody gives me a sweet and if I'm really depressed, I may not feel like eating that sweet, I may not enjoy that. Similarly, people also come up with either increase or decrease in their appetite as well as sleep. So some people have the tendency to eat more, some people have the tendency to eat less. Some people have the tendency to sleep more, similarly some people have the tendency to sleep less. And even though people, when they do not get into any kind of activity, there is a high possibility they may experience fatigue. Often we come across people, okay, who are depressed. They may not be doing anything right from morning till evening. They are in the bed, okay, they are watching some television, they are surfing net, or they might be reading a book, or they may not be doing anything. And towards the end of the day, if you ask them, why don't you go for a walk, they often come up saying that I'm feeling very weak, I don't want to go for a walk, despite the fact they were sleeping, they were just lazing around the entire day. So people who are depressed, they also cry a lot. Okay, you experience crying spells. There is something called emotional incontinence. Some people have a tendency to be tearful even if you for the slightest remark that you make towards them, and some people have a tendency to get isolated, they get withdrawn. Okay, and as Dr. Vidya Sagar mentioned, people have a tendency to feel hopeless, helpless, worthless. They think that life is not worth living, and they feel very guilty because they are not able to carry out their day-to-day activities and meaningful activity. They feel very irritable. Even a smallest remark, they get so irritated. They have several physical symptoms like generalized aches and aches and pains. They keep complaining, saying that I have ache in the lower limbs, that I have headache, that I have that ache, that I have this ache. They also have very low self-esteem. They think very low of themselves, and they withdraw from social events and friends and family. Okay, they may have thick friends. When they come and when they tell them that, okay, come, let's go for a walk, they say that I'm not really interested, I don't feel like walking. And they don't even enjoy jokes, let me tell you. So you may put on TV and there are a lot of jokes that might be coming, and long back probably the same gentleman must have giggled and laughed by looking at Brahmanandan's face, but Brahmanandan's face no longer induces any kind of jocularity in this particular individual, because he or she is suffering from depression. And some people who are severely depressed and moderately depressed, they also talk about suicidal ideation. They would like to put an end to their life, and they also get into deliberate self-harm. They also experience difficulty in keeping up with daily tasks and demands of life. These are some of the broad signs and symptoms of people who have depressive mood. Let me tell you, there is a subtle distinction between signs, symptoms. Signs are the things that a professional understands from the physical presence of a patient, whereas symptoms are those things a patient reports to the professional psychologist or professional psychiatrist. These are broadly the signs of depressive mood. While mentioning that, on the other hand, there are certain symptoms of manic and hypomanic individuals. They feel extremely energized and they feel elated. They feel so happy about themselves, and they talk so fast, and their speech is often characterized by rapid speed. They have rapid movements. They are very restless. They can't stay at one place, and they are very agitated. They are very restless. They are highly irritable. They get into a lot of risk-taking behaviors, and they also try to take on many activities at one go. They don't have that semblance and cognitive judgment of, can we finish these many tasks in the given point of time? And they have racing of thoughts, one thought after other thought after other thought. They also feel very edgy, and they have grandiosity. They feel no end of themselves. Sometimes they feel that they can do lot many things. They are great scientists and they are ministers. They can transform this world. They can discover and invent new things and all that. I still remember when I was doing my clinical training, I had a very interesting experience. One individual has been brought up by his parents with a manic episode. That gentleman has seen a Telugu movie by name Kaidi, wherein Chiranjeevi acted, and after watching that movie has worked as a precipitating factor for him. He went early in the morning to some place, and he has cut off all the trees with greatest energy. So people who suffer from mania and hypomanic episode, they are highly energized. You find it difficult to stop them. They speak a lot. Sometimes they also speak incoherently, and these are all some of the signs and symptoms of hypomanic individuals that they report. So how do we actually assess? What we generally do is, people like me and Dr. Vidya Sagar, when we are practitioners, when patients come and sit before us, and when they talk about their problems, we ask them, how is your mood? How have you been? Generally, how do you describe your mood? Mood is sometimes a technical word. People find it difficult to understand, and we ask them, are you feeling okay? Are you feeling disturbed? Are you feeling despair? Are you scared? Are you feeling fearful? How are you feeling agitated? So we give a lot of clues to understand the symptomatology, to understand the psychological state, in other words, mental state of an individual. So asking questions, we elicit that kind of information through mental state examination, and we also ask others. And let me also mention, there are certain things when somebody comes and sits before us. How did he sit? Okay, is he sitting like this? Is he maintaining eye contact? So from all these gestures, we infer whether somebody is suffering from either depression or mania. So these are the two aspects of two broad aspects of mood disorders at a conceptual level. There is a classification. I'll come to that at a later point of time. It's not easy to diagnose whether somebody is depressed or not just like that. So whether somebody is depressed mildly, moderately, severely, whether somebody is suffering from primarily depression or whether an individual's depression is secondary to some other problem, these are all major issues. We look into it. Let me tell you today in this 1 hour, what me and Dr. Vidya Sagar, what we would be discussing is only tip of the iceberg. We are only discussing certain broad anchors, certain broad issues related to mood disorders to give all of you an awareness, an understanding, a comprehension.
Yes, thank you, sir. Really very symptoms and that assessments very clearly we can understand about your discussion. Dr. Vidya Sagar, generally the mood disorders or unipolar or bipolar disorders may lead to risk factors of suicidal tendency.
Yes.
And also about 1/2 or 2/3 of suicides, all suicides are by people with who are suffering for this mood disorders.
Yeah.
Generally. So what is the connection between this mood disorder and this suicide?
Yes.
How can we analyze it?
Yeah. So as you have already mentioned, the research, like one of the researchers shows that 60% of those people who die by suicide, 60% of them have mood disorders. So you can see the influence of mood disorders, how they are connected to suicide. Because 60% of those who all die by suicide, they all have mood disorders. Okay. Now, for example, if you take depression, depression is basically you have persistent sad mood. Okay, so you are feeling sad continuously throughout the day most of the time. So like when we do therapy, we do something called, let's say, cognitive behavior therapy, so which talks about your thoughts, your emotions, your behaviors. So the way you think affects your emotions. Okay, the way you think affects your behavior. Same way, your emotion also has the potential to color your thinking. Your mood has the potential to color your thinking. That is, when you are feeling sad, you won't have thoughts like, I want to learn this, I want to develop this, I want to grow, right? Like same way, when you are happy, you won't have thoughts like, I'm not good enough, what is the point of my life? So your mood has the potential to influence your thinking. So when you are sad, you tend to think negatively. When you are sad, you tend to withdraw, right? So probably it would not lead to any solution to any of the problem. You might end up being getting stuck in that vicious cycle. Okay. So now, as we have seen, certain kinds of thinking process are associated with suicide. One of the single or strongest predictor of suicide is hopelessness. Okay. People believing that they don't have any hope, nothing is going to change. They can't do anything about the future. Also, at times, they talk about being a burden to family members, being a burden to people around, they being useless. And it is also important that one of the warning signs that people might be thinking about suicide, or they might engage in suicide, is talking about suicide itself. So that's why, as sir said, as part of the assessment, we need to explicitly ask them, do they have any suicidal ideas, right? Most of us, we ourselves are not comfortable to ask people about, are they contemplating suicide, or if they are contemplating, they have already made plans. Okay, so it is important to ask people about suicide. Okay, and also they probably start giving things away, and probably clearing whatever the things that they have. So these are all the signs that probably these people are thinking about, and they also feel like they don't belong, or they don't connect to any of the people around. So they feel socially isolated, they feel disconnected, they feel hopeless, they feel like a burden. Okay, these are all different signs of suicide. Okay, and mood disorders mood disorders have the potential to color their thinking and influence their thinking in this direction. Okay, so they probably won't be able to see other side of the story. So that is why it is important to quickly recognize mood disorders, treat mood disorders, because it can prevent various it can prevent these suicides, right? So that's how mood disorders would influence or they are associated with probably suicides. Yeah.
Yeah. Generally, Sir Dr. Viswanath garu, based on this your symptoms and causes, the Sagars say something about the connection between suicide and disorders, mood disorders. So how the mood disorders are classified? So what are the criteria or what are the classification are available at present?
Yeah, as I mentioned a few minutes ago, before getting into classification, once again I would like to make a distinction between bipolar disorder that includes manic episodes and bipolar disorders that include depressive episode. If you look at bipolar disorders that include manic episode, okay, they are overly very happy, as I mentioned, that too for a long period of time. They talk very fast and with racing of ideas, and they become easily distracted. You find it difficult to make them sit and talk to them. And they also have overconfidence in their abilities, and they engage in quite a few risky behaviors. We often see people who are who go through this kind of manic episode. They spend all their money, they also exhaust all their credit cards and all that. Whereas people who undergo the depressive episode, they feel sad and hopeless for a very long period of time. You can see significant change in their appetite, thinking about or attempting suicide. Okay, that's the reason why, as Dr. Vidya Sagar said, we have to elicit that aspect. They feel fatigued and they have problems with memory and cognitive impairment, and they have decreased concentration. This is, to begin with, this is one level of classification. Okay, and let me also tell you, if you carefully examine, I'm not using the words ICD and DSM intentionally, okay, but these are some of the disorders that have been identified. One is dysthymia. Second one is dysthymia is a person who has depression for a great length of time. We often call them as a kind of person who has dysthymic personality disorder. I'm sure that you must have seen people who look so depressed, who doesn't want to interact with people, who always appear to be dull, who always like to withdraw themselves from others, and who would like to enjoy their isolation. And when it comes to depression, you have mild depression, you have moderate depression, you have severe depression, you also have severe depression with psychosis. There is another diagnostic conundrum, I am not getting into that, that is called schizoaffective disorder, that is beyond the scope of this particular deliberation. There is another thing called cyclothymia, okay, and subsequent to that, hypomania and mania with psychosis, and bipolar affective disorder and recurrent depressive disorder. In fact, what we generally do is when we have this bipolar affective disorder, we draw a specific graph and we draw a line and we draw a graph of ups and downs. How many times in your life you had ups? How many times you have this downs? That's what we ask. And when we are classifying mood disorders, we look at these mood disorders as a spectrum disorder. In fact, the contemporary thinking is, whenever you look at any kind of disorder, you look at from spectrum method, because that gives the clinician to develop a holistic understanding of the person. If you look at the topmost one, depressive disorder, you only have depression, mild, moderate, severe, and severe depression with psychosis. Whereas in between you have people who have dysthymia, you have normal mood, which is otherwise called as euthymia, and slight elation, that is called cyclothymia. So when you have a recurrent depressive disorder, you also have many episodes like severe depression with psychosis. And when you are talking about bipolar affective disorder, the whole range, starting from mania with psychosis to severe depression with psychosis, goes on. So, in the history of psychiatry, mood disorders have been classified in many ways, and there are many nomenclatures that have been given for mood disorders. Okay, as I mentioned, emotional disorders and affective disorders, it is whole lot of a subject. But to begin with, from the perspective of UG students and PG students, if you understand this much about the spectrum analysis of mood disorders, I think that's good enough for you. Sir?
Yes, sir. Yeah. Dr. Vidya Sagar, generally we know, as per the latest NCRB, National Crime Reports Bureau data, according to the data, the national suicide rate stood at 12.4% people in 2022. So overall, that 49,000 people died by suicide in 2022. So based on this, that is one death every 11 minutes. So how we can identify warning signs of this suicide?
Yeah.
So what is the criteria, or how do we can identify the signs of the suicidal tendencies?
Yeah. So as I have already mentioned, I've talked about various factors that are associated with suicide. Like for example, like having a mood disorder, like either depression or mania or bipolar disorder, is a risk factor for suicide. So if you find somebody who is having mood disorder, then probably you can suspect that they might be having suicidal ideas. So it's better to check with them. Okay, ask them whether they are contemplating or thinking about suicide, or whether they have any death wishes, or have they actually planned or have they identified the means by which they are going to commit suicide. So now one is to identify whether they have any psychiatric problem. Okay, if they have a psychiatric problem, then you check with them whether they are contemplating suicide, whether they have death wishes. And the second thing is, like as I already mentioned, hopelessness is one of the significant predictors of suicide. If your friend or if your family member or relative, if they are talking about being hopeless, it's a serious indicator that it might lead to suicide. Okay, so it is important that we need to address that particular factor. And then again, if they are talking about suicide itself, like even without you asking, they might start talking about death and dying and all those things. So it's important that you pay attention to that. And next thing is whether they might be telling to their family members that I'm like a burden to all of you. There is no point of me living. I'm worthless. I'm useless. Okay, I don't see any hope in the future. So if they are talking like that, and if they are feeling, if they are isolating themselves from people around, withdrawing, and there is no connection with people around, I think these are all definite signs that they might be contemplating suicide, or probably whatever the things that they want to clear out. So usually people, they want, before they die, they want to clear off everything. So they might give away things, or if they have any debts, they might clear off those things. So debts not in terms of just money, but any form of debts. Like I'm indebted to somebody because they helped me, so they might want to clear off those things. So if they are trying to do those things, it is an indication that they are trying to, like they are probably actively making plans about suicide. And if they already had any history of suicide attempt, okay, that is also something, an indicator of the indicator that they are at risk for suicide. Also, if any of the family members died by suicide, or if they are going through any major life event, like they lost somebody, or they are going through any kind of a loss, like loss of a job, any of those things. So it is important that those are the situations in which those situations actually put people put them at the risk of probably contemplating suicide or thinking about suicide. So it is important to look for these factors.
Right. Very nice, Dr. Vidya Sagar. And Dr. Viswanath garu, do you have any specific or generic advice for our UG, PG and diploma students of psychology about this mood disorders or suicidal tendencies?
Yeah, sure. Number one, we are all human beings and we are vulnerable and none of us are gods and saints, and all of us go through difficulties in life, and when we go through difficulties, it is but for natural we feel sad and we feel disturbed, but every moment of sadness and every moment of disturbance may not be equated with mood disorder. So if you are feeling sad for 1 day or 2 days, for 1 week or 2 weeks, you don't have to label yourself as a person who has a mood disorder, who has a depression, and who has mild depression, moderate depression and all that. So don't get into that kind of self-diagnostic mode of having a mood disorder. Second piece of advice to all of you would be, if your disturbance continues and if your sleep is impacted, if your biological functioning, social functioning, intellectual functioning is impaired for a great length of time, for about 4 to 5 weeks, just a broad indicator, okay. So my request to all of you would be, it is essential for you to go through a good assessment, a good professional assessment, so that they will tell you where you stand and how your moods have been and how your functioning has been, whether you would qualify for a brief diagnosis. And it's okay to have to be depressed, and many people get depressed in life. It is normal to get depressed. And you don't have to make a monster out of a mild depression or a moderate depression. And the third aspect is, I would like to recommend one book to all UG and PG students and diploma students. The title of the book is Feeling Good. It was written by David Burns. David Burns is a cognitive behavior therapist. A beautiful book, and his book Feeling Good is one of the best sellers and it is available everywhere. It is available in Hyderabad, and everywhere it is available. And I would request every psychology student to read this book from page 1 to page end, so that they will be able to integrate the information that has been given in this book. Beautifully, David Burns has outlined a lot of cognitive distortions that are associated with cognitive triad and negative views of oneself, negative views of the future, and negative views of others. And Dr. Burns helps you to identify what kind of cognitive distortions you have through a kind of questionnaire which has been outlined in the book. And I suggest that all of you should read that book to empower yourself, to update your knowledge and educate yourself, reading on mood disorders. Awareness is the origin of consciousness. That's what Galileo said. Once you have awareness, you have a tendency of becoming alert, and you will take right kind of help, and you will also be able to give right kind of help to others. And I suggest that all of you should have all of us, we require support systems. Having good support system will help us move forward, will help us develop a psychological immune system to ourselves, okay, which will protect as a kind of shield from major depressive disorders. And kindly don't get into self-medicating yourself, okay. Don't try to go and buy some kind of drug for depression, for mild depression, for sleeplessness and all that. In the long run, that will only do a lot of damage. And many people have been interested in pop psychology in the recent past. When people are depressed, though you don't want to do, your colleagues and your friends and your near ones and dear ones tell you that if you do yoga, your depression will come down. Let me tell you, you need to inculcate a scientific approach. Yoga is not the solution for depression. In fact, in psychiatry literature, it has been documented that yoga will increase your depression, because when you do yoga, if you are really depressed, if you have a moderate to severe depression, there is a phenomenon called somatic amplification takes place. As a result of that, you find it difficult to handle that. So don't get into the generic rules of the game, which a lot of people say that may not hold water, but get yourself tested, get yourself examined, and take a good advice from a clinical psychologist or a mental health professional. And let me also tell you, women are more vulnerable to depression compared to that of men. That's what statistics say. Even in Indian population, the prevalence rates are very high. Hence, be careful and have a support system. Have a good understanding about depression, and psycho-educate yourself. That's very important. I think that's where these are some of the brief things that I want to drive home at this point of time.
Okay, thank you, sir, Dr. Viswanath garu and Dr. Vidya Sagar. So generally, we know everything about the causes and the understanding of the mood disorders. Generally, you as a clinical psychologist, you are in the field from the last so many years. What are the treatments available for this kind of disorders or suicidal tendencies?
Yeah, I think it's that's a very important question because it is important to be aware of the kind of treatments that are available.
Yes.
There are two kinds of treatments primarily. One is pharmacotherapy and the other one is psychotherapy. In pharmacotherapy, you probably use psychiatric medication. Okay. So as we had already seen, there are various neurochemical abnormalities that are associated with these mood disorders. So primarily this psychiatric medication is going to correct those abnormalities. So usually people have some negative attitude towards medication, that it might develop side effects and I might get addicted to. There is definitely some truth to it, but again, you need to be like when you are completely dysfunctional, when you are not able to act, and when you are not in a position to even to take therapy, it's okay to take medication. Okay, and your psychiatrist will be able to help you with all those side effects as well. Okay, so rather than just thinking to yourself that so I don't want to take medication, it's better to get help and get better. And once you get better, probably you can slowly choose to probably taper down the medication with the help of your psychiatrist, and probably also at the same time undergo psychotherapy. So there is pharmacotherapy and there is psychotherapy. Okay, in psychotherapy there are various forms of psychotherapy. So one is called cognitive behavior therapy. So as we have seen, thinking plays a major role in these depressive disorders or mood disorders. So basically cognitive behavior therapist focuses on helping the people identify their faulty thinking processes and also correct them, thereby changing the mood. Okay, so that I'm explaining these things in a very simple way. It takes probably a course to understand these things. Okay, so cognitive behavior therapy, and then there are mindfulness based therapies where your primary approach is to focus on being mindful, develop the ability to be mindful, where it is basically it changes, it helps us to get out of that negative thinking style or repetitive thinking patterns that these individuals get stuck in. Their tendency to interpret events in a negative way. So it helps you to come out of this. As sir said, awareness is very important. So what you are not aware, you cannot change. So basically these therapies help you to become self-aware, also develop ability to distance yourself from these experiences so that you can handle them. So like for example, you don't see yourself as your thought. You have thoughts, but you are not your thought. You have feelings, but you are not your feelings. So there are different skills that you will develop where you learn to handle these situations and probably prevent future episodes as well. And when it comes to bipolar disorders, one important thing is we call it interpersonal social rhythms therapy. Okay, in bipolar disorder, one of the main factors is that you maintain your social rhythms or biological rhythms. Your sleep-wake cycle needs to be appropriate, because if you don't have enough sleep, that is a warning sign that you might develop again one more episode of mania. So it is important that you you maintain your biological rhythms. Also, it is also the research shows that interpersonal stressors, okay, like role transitions, conflicts with family members, loss of a loved one. So all these factors can lead or trigger these mood episodes. So it is important to focus on those things as well. Also, we need to have social support. we need to have the support of the family. So there is family therapy, and also probably finding some social support in terms of groups. Okay, groups who are people, individuals who are going through similar psychiatric problems, and discussing with them will help you. Okay, understand, I'm not alone, but there are people who are also going through. And there is also one more element, I think, that is in the recent times it is focused much, is it is self-compassion. So self-compassion is where you develop compassion for yourself. It is going to counter against self-criticism usually people with depression have. So these are various psychiatric psychotherapies that are used to treat depression, and like for example interpersonal social rhythms therapy, mindful based therapies, and cognitive behavior therapies. They also have a lot of research evidence that they show that it is effective. So you can probably look up into probably literature, you can read by yourself and understand, and usually the research says the combination of pharmacotherapy and psychotherapy is more effective than individual therapy alone. Okay.
Thank you, Sagar. So based on these treatments, sir, Viswanath garu, any other tips for previous this kind of treatments? Please explain anything.
Yeah, I think I did mention to all of you, ask yourself 3 questions. Number 1, from the past 1 month, from the past 1.5 months, from the past 6 weeks, is my biological functioning okay? Because you are the best judge. Okay, is my sleep okay? Is my appetite okay? Is my overall functioning, biological functioning okay? If you get a response, no, that's a cause of concern for you. 2, is my social functioning okay? Okay, am I interacting well with my friends? Am I interacting well with my family members? Am I going to job regularly? Am I focusing well on the tasks that I have? Okay, this is the kind of social functioning. If you get a response that no, that's a cause of concern again. 3, am I attending well? Is my concentration okay? Am I cognitively fit? Do I experience cognitive slowness? Am I analyzing well? Am I synthesizing well? Is my judgment okay? These are the questions that you have to ask. And if you get a no for this, that's again a cause of concern. Okay, if you get a no, you have to take yourself a little seriously, and you have to focus on your mental well-being and psychological health, and you have to approach a mental health professional and take help. However, if you get yes, that means that you're doing well, you don't have to really worry about yourself. Let me tell you, I would like to focus on what Dr. Vidya Sagar has mentioned about cognitive therapy. There is a John Milton who has written Paradise Lost. In his 9th book, he says that mind is in its own place. It can make a hell of heaven. The same mind can make a heaven of hell. In other words, somebody else said that men are not disturbed by the events per se, but they are disturbed by the interpretations of the events that they have. So, do a very good cognitive appraisal. Develop awareness about the way you are thinking, about your thinking style. Probably managing your thinking style will help you to overcome this kind of problems. And lastly, I would say that people who are depressed, they have a tendency to get isolated, to get withdrawn, not to get into any kind of activities. There is something called behavioral activation. You need to activate your behavior, you need to take initiative, you need to push yourself to get into more of such kind of activities, so that you are taking good care of yourself. These are some of the things that I thought that I can bring home at this point of time.
Yeah, thank you, sir. So finally, one more question, Dr. Vidya Sagar. So you mentioned some of the therapies. For this, which therapies should I choose for the betterment of this kind of?
Yeah, I think that's again one important question, because there are many therapies that are available. like for example cognitive behavior therapy, mindful based therapies, acceptance and commitment therapy. There are various forms of psychotherapies that are available, emotion focused therapy, family therapy. Okay, I think it depends upon, because the presentation of depression is not same for each individual. Okay, so it's important to understand what is the unique presentation. So it requires a thorough assessment, as sir said. We need to thoroughly assess what are the causes and what is the history, and all those factors we need to take into account. Like let's say for example, if somebody has dysthymia, or which is a chronic mood disorder, or if somebody has recurrent depressive disorder, it might also indicate that the person might have an underlying personality issue. So then the picture becomes complex. Okay, and the person might also have, along with depression, they might also have some anxiety related symptoms. So there are comorbidities that are associated with that particular illness, and the individual with depression might also have undergone, let's say, some trauma in childhood, okay, which is probably triggering these episodes again and again. So you need to address that trauma as well. So that means what is required is a thorough assessment to understand what are the complexities involved, what is the unique presentation. Depending upon that, probably you need to consult a clinical psychologist or a psychologist. You need to discuss with them and find out what therapy suits you. Okay, so it is not easy to say that which therapy should I choose. Okay, so depending upon the presentation, depending upon the complexity, comorbidities, history, so various factors are they needed to be taken into account. Sometimes maybe some therapies may not, like you might not relate to some therapies. That's okay. You can probably then identify the therapies that you might relate to. So you can probably find out other people, other therapists who can give you different forms of therapy. But initially, thorough assessment is required.
Yeah, thank you very much, Dr. Vidya Sagar and Dr. Viswanath garu. Today we are already discussed about the these mood disorders. So finally, one more small questions to Dr. Viswanath garu. So generally, people are asking and doing their psychological well-being in terms of meditation, yoga, dhyanam, like that. Is it work for this kind of disorders?
Sir, I would agree with Vidya Sagar sir. There is an adage in clinical psychology: different strokes for different folks. Okay, what works well with one person may not work well with the other person.
Okay.
Okay, it depends on the educational background. It depends on the severity of the problem. It depends on the receptivity of the person. It depends on many aspects. See, if you look at cognitive behavior therapy, there is something called core schemas, identifying core schemas. Some people may have little difficulty in doing that. So different strokes for different folks. Okay, there is no universal, there is no multivitamin tablet for this.
Yeah.
I would say that they have to sit with the therapist and they have to discuss their concerns with the therapist, and they have to take right kind of help from them.
So thank you sir. Thank you Dr. Viswanath garu and Dr. Vidya Sagar garu. Today we are hello.
Hello. How are you?
Tell me.
I have a doubt.
Please express yourself.
Yes. So I'm Jansi and I'm first year PG student.
Okay.
So the doubt is, I want the faculty to explain the difference between self-induced and atmosphere-induced suicidal tendencies.
Yeah.
Okay. Yeah, would you like to go? Yeah. See, probably self-induced. I don't know whether I'm comfortable with that term, self-induced. I mean, it's obviously everything is self plays a role. So self-induced is where basically your thinking plays a role in that, and the way you perceive, like as sir said, men are not disturbed by events but the way you perceive them. So like when I experience a failure, the way I talk to myself, the way I perceive it determines like what happens in the future. Like if I see a failure as like I'm good for nothing, I'm a total failure, probably my mood will change, and if my mood will change, I withdraw myself, and probably I won't engage in any active action. So it leads to probably not resulting in any possibility of me doing better. So again I am falling in the same cycle. So a person might decide that as an escape, and I'm not going to, the situation is not going to change, so they might feel helpless and might give up. So it might lead to again suicide. I don't know what you actually meant by atmosphere induced. Is it environment induced? Is it you are talking about weather induced? If I can get some clarity about it, probably I would be able to answer that.
Yeah, thank you sir, thank you Dr. Viswanath garu, Dr. Vidya Sagar garu. We are going